So what are some of the results that, I mean, we don't time to a particular patient, but, what are some of the feedback you've got from people that have gone through ketamine? Hey, what do they feel right after the infusion and maybe like a day or two later?
So ketamine is really unique in the idea that as an antidepressant, it's the only option that we have that is immediate acting, meaning that in just one single IV infusion, we can dramatically decrease a severe episode and a patient who may be experiencing suicidality, maybe even with suicidal intention. We're starting to see ketamine being used sometimes in inpatient setting, which is really new, meaning that if a patient comes in acutely suicidal, one of their first treatments may be an infusion of IV ketamine to help dramatically decrease those really severe symptoms really, really quickly. And whereas the typical antidepressant, as many people know, can take weeks, 4 to 6 weeks to be fully effective. And in ketamine, we can see if somebody is going to respond positively to ketamine right away. We don't have to wait weeks to see if it's going to work. And the idea is that ketamine, and we'll talk a little bit about the stellate ganglion block too. Ketamine is an entire different approach to treating depressive type symptoms. We like to think in, my kind of psych community and the places and the people that I work with right now, and I said I kind of had a shift in my psychiatric perspective, is that we're starting to approach treatment as a biological process versus managing the symptoms. And so instead of thinking of somebody you have depression, somebody is experiencing depressive symptoms because something's not going well. And that not going well oftentimes is something in the brain or the nervous system. And so in particular with ketamine, we know that there's less interconnectivity and decreased neuronal connection in particular areas of the prefrontal cortex, in the hippocampus, and so forth. We know that there's less dendritic connection, less brain-derived nutrient factor, and it's kind of that if you don't use it, you lose it mentality. And so when those areas slow, they tend to kind of, spiral downwards. And so this is where we see depression worsens over years, or people who have periods of depression, they become more frequent as they age.